IUI versus IVF as your first step when you're just getting started out, especially if you have a diagnosis of unexplained infertility. This is a question I get asked all the time. I discuss it with patients multiple times every single day, every week. So I want to give you a quick overview of these two treatment options and compare and contrast some of the pros and cons. First, let's talk about medicated IUI. I like to compare medicated IUI to the analogy of speed dating, right? When you ovulate one egg every cycle and you're just hoping for that egg to meet the right sperm in the fallopian tube, it's kind of akin to going out with your friends and hoping to meet the one. And then you have medicated IUI, where you're taking medications, usually oral medications, to give your body the opportunity or chance to release more than one egg. And at the same time, you're doing something called intrauterine insemination, where we're taking a sample of sperm from your partner or using frozen donor sperm, and we're concentrating it, washing it, and injecting it at the top of the uterus. So I call that speed dating because it's multiple eggs, multiple sperm, in the hopes that an interaction will take place and one of them will turn into an embryo that implants. If you think about it, it's not that different than what you are doing on your own if you've been able to try on your own with timed intercourse. It's just giving you a little extra nudge in the right direction on the egg side and the sperm side. This is in contrast to IVF, which is completely different, right? You're taking injectable medications to try to get every single egg that we can get to grow. And this is why numbers are so important. And people with high ovarian reserve tend to do better with IVF because we have a lot more eggs to access. We fertilize each one of them and we try to get as many embryos as we can. And if you choose to, you can genetically test these embryos. This is called pre-implantation genetic testing, or PGT. And this can help to identify which embryos have high reproductive potential and those that do not. Then you can select one embryo at a time and place it in the perfect spot at the top of the uterus and keep the rest of them frozen. If that first one implants, great. If not, then the following cycle or month, you can try with the next embryo that you thaw. Now, here are the major differences between medicated IUI and IVF. First off, medicated IUI is a lot more laid back. Like I said earlier, it is kind of mirroring what you're already doing on your own, just augmenting things on both the egg and the sperm side. So it's not as burdensome as IVF. There's nothing that invasive about it. You're really just taking the pills for 5 days and then coming in for an ultrasound. We may give you an injectable medication, often that the nurses themselves can administer for you, that will make you release the eggs in a timed fashion. And even the insemination kind of feels like having a pap smear. It's not a big surgery or anything like that. There's definitely no anesthesia and it's not painful. But with that comes laid back success rates. So in comparison to IVF, it is not that efficient or effective of a treatment option. But if you're doing multiple, your cumulative probability can get to an acceptable level. And that's why we often talk about knowing when to fold them after doing several IUI rounds. If you're able to make high quality embryos with IVF, you tend to get pregnant quicker, right? If you have a euploid healthy embryo with a good grade, typically we say there's like a 60 to 70% chance of achieving a live birth from one transfer, which means after 3 transfers, your cumulative success rate approaches 95%. Most people will get pregnant within 3 transfers. And so it is more effective with a shorter time to pregnancy than medicated IUI. IVF requires more of the patient and there is more infrastructure needed. We use an IVF laboratory with expensive equipment. We have specialists called embryologists that are doing these micro procedures on the eggs and handling the sperm and the embryos. So there's a lot more cost associated with it, and it is more of a burden to the patient. But in addition to getting you pregnant faster, it can offer several key advantages over IUI. One is by selecting out an embryo that is healthy for transfer, you know it has the right number of chromosomes based on the testing, you are lowering the risk of miscarriage. The number one cause of miscarriage in the first trimester is having an embryo that implanted that had the wrong amount of DNA, missing or extra chromosomes. So by weeding those out, you are reducing that risk. You're also increasing the confidence to put back one embryo at a time. And so the risk of twins is actually lower than what you'll get with medicated IUI. If you're only transferring one embryo at a time, it is very rare to have twins unless that embryo splits, which can happen around 2% of the time. When it comes to medicated IUI, you can't control exactly how many eggs that are released actually get fertilized and actually implant. And so the typical rate of twins that we'll quote to patients who are taking oral medications like letrozole or Clomid alongside IUI treatment is around 3 to 8%. This is why we bring people in for an ultrasound in their mid-cycle when they're on these medications, because if they have an over-response, we have the opportunity to cancel the cycle to lower the risk of multiple pregnancy. I think the biggest difference between medicated IUI and IVF, and one of the biggest differentiators that really push people in one direction or the other when they're thinking about what they want to do as their first step, is the ability to take the opportunity to preserve your fertility by freezing extra embryos with the process of IVF. Obviously, medicated IUI is all about the here and now, trying to get you to be more likely to get pregnant now, but it can't allow you to preserve for the future. So particularly for people that are pursuing this over the age of 35, especially over 38, and they know they want to have multiple children, it may make sense to think about IVF as a first step. Because here's the thing. The amount of time that the embryos are stored and frozen and the age you are when you come back to use them have no bearing on their reproductive potential and your ability to get pregnant. So it can be a really convenient reproductive hack, so to speak, to get around the biological clock so that you can still have a great chance at building the family of your dreams, regardless of when you got started.